synapse is the junction between two neurons, and the two neurons, they are also termed in a special way. That is, the neuron that is seen in front of the synapse is called presynaptic neuron, and the neuron behind the synapse is called postsynaptic neuron. That are the two terms which you have to know when you come to the synapse section. Okay. But whereas in the case of neuromuscular junction, we have to know about the neuron, as well as the other part is postsynaptic membrane is the muscle. Okay. So here it is two neurons. The neuron that is seen in front of the synapse, or the nerve that is seen in front of the synapse, is called presynaptic neuron, and the other one behind that one is called the postsynaptic neuron. Now, about the classification of neurons. Classification of synapse. Synapse is classified in two ways. Main classification. It is in two ways. You know which are they? Which they are? Any idea?
Chemical and electrical.
Okay, that is one type of classification, which is also called functional classification. And
there is axodendritic, axosomatic.
Exactly, yes. That is anatomical classification of synapse. So synapse is classified in two ways, or synapses, it is classified in two ways. One classification is anatomical classification, and the other one is physiological or functional classification. So anatomical classification is based on the areas or based on the parts that are involved in synapse, or that form the synapse, the areas of the neurons, two neurons that form the synapse. Whereas functional classification is purely based on the type or the way one neuron communicates with the other. That's the difference between these two classifications. So the first one is anatomical classification, which is based on the parts of neurons involved in synapse. So it is mainly divided into three, as axodendritic, axosomatic, and axoaxonic. And there is one more type, that is dendrodendritic. It is very rare, but still such a classification is also there. These are the three main types which are seen in our body. First one is axodendritic, in which the synapse is formed between the axon of presynaptic neuron and the dendrite of postsynaptic neuron. Okay. Anyway, you know the parts of a neuron, right? The parts of neuron. Can you hear me? Olin?
Yeah, soma, axon, dendrites.
Okay, fine. So first comes the soma, or the cell body. Then it is surrounded by dendrites, and there is one long process, that is the axon. And based on that also, there are neurons are of different types. Anyway, I'm not going into the details of neuronal types. So coming back to our topic, that is the axon, or sorry, the neuron. It has got a cell body, then it is surrounded by dendrites, and there is one long process called the axon. Now here, in the first type, that is axodendritic synapse, the synapse is formed between the axon of presynaptic neuron and dendrite of the postsynaptic neuron. Okay, so I hope you can understand the structure. I mean, you can imagine how it is. The axon of presynaptic neuron and dendrite of postsynaptic neuron. The next one is axosomatic synapse. That means the synapses between axon of presynaptic neuron and the cell body, or the soma portion of the postsynaptic neuron. So they don't have any connection, or they do not communicate with the dendrite part. Instead, the presynaptic neuron will pass the information directly to the cell body. It's not to the dendrite. Okay, that's the difference. And the third one is Axoaxonic synapse. Means both the pre and post synaptic neuron axons will be coming into the synaptic formation. Okay, both the axons. It is not the dendrite, it's not the cell body, but the axon portion. So axon of presynaptic neuron and axon of postsynaptic neuron forms axoaxonic synapse. Among these three, the first one, axodendritic synapse, is the most common type of synapse seen in our body. Okay, axodendritic. Yeah, here it is. The first one is axodendritic synapse, this one. I hope you can see that. This is axodendritic synapse.
Attached to dendrites.
Yeah, axon of presynaptic neuron and dendrite of postsynaptic neuron. So this forms the axodendritic synapse. Now, when it comes to axosomatic synapse, this is the axon of presynaptic neuron and it communicates directly with the soma of postsynaptic neuron or the cell body of postsynaptic neuron. And the last one is axoaxonic synapse. Here, they are almost in perpendicular angle. So the axon of presynaptic neuron communicates with the axon of postsynaptic neuron. This is rare, still it's present, but still it is rare. And axodendritic synapse is the most common type seen in our body. Okay, so this is the anatomical classification of synapse. And then to say about the functional classification or the physiological classification of synapse, it is based on the mode of impulse transmission. It is based on the way through which the two neurons communicate with each other. And I hope you know that synaptic transmission is unidirectional. You know that?
Yes.
Yes. From it will always move from the presynaptic neuron to the postsynaptic neuron. Okay, so it is unidirectional. So the functional classification of synapse is based on the type of or based on the way through which the presynaptic neuron communicates with the postsynaptic neuron. And the first one is electrical synapse and the other one is chemical synapse. Now, mostly the most common type of synapse seen in our body is chemical synapse, functional type. The chemical synapse is the most common type of synapse seen in our body in which the presynaptic neuron communicates with the postsynaptic neuron by releasing certain chemicals called neurotransmitters. Okay, those chemicals are called neurotransmitters. And I hope you know various types of neurotransmitters. Just name one or two.
Acetylcholine.
Okay.
The acetylcholine, gamma aminobutyric acid.
Okay, GABA, which we call GABA. Okay. Then glutamate, epinephrine, or adrenaline. It is also called adrenaline. Yeah. Then serotonin, dopamine, etc. There are many neurotransmitters. And the release of such neurotransmitters by the presynaptic neuron is called chemical synapse. And in that case, in the chemical synapse, there is no sort of continuity, or the two neurons will never come in close contact with each other, or they are not merging. Okay, there is no continuity between these two neurons. They are completely separate, and there is a gap in between them. Between the presynaptic and postsynaptic neuron, there is a gap, and that gap is called synapse or synaptic cleft, which is the specific term for that. So the two neurons, they don't have any physical continuity, and there is a cleft or synaptic cleft in between them. And these neurotransmitters are being released into this synaptic cleft. That is chemical synapse. And the other one is electrical synapse. Electrical synapse means there is a physiological continuity between the presynaptic and postsynaptic neuron. And the best example for this one, I mean, we can simply think about that. That is the intercalated disc seen in between the cardiac muscles. I hope you know the structure of muscles, right? Skeletal, smooth, and cardiac muscles. Yeah, of that skeletal muscles, they are not branched. They are all unbranched muscle fibers. Then smooth muscles, they are mostly unbranched muscle fibers, but there are certain muscle fibers, especially seen in the stomach, then in the uterine walls, etc., which have branches, or there is continuation, or there is a junction, or some sort of connections between the individual muscle fibers in the case of smooth muscles. And in the case of cardiac muscles, the muscles are completely branched muscles. And at the base of each branch, we can see a specialized structure called intercalated disc. And that specialized structure, it is actually a modified gap junction. I hope you know what is a gap, you know what is a cell junction, right?
Yes.
Yes. So, okay. So give me the answer. What is the cell junction?
Cell junction is the connection between two cells.
Okay. Connection. We can't say it as a connection. We can say it as a junction. Okay. Yeah.
Two adjacent cells.
Yeah. Adjacent cells. Like there are many types of junctions, cell junctions. One is the tight junction, then comes the gap junctions, then adhesions, etc. Okay. So tight junction and gap junction both are entirely different, and I hope you know what is the difference between them. Tight junction means the two adjacent cells will not be having any sort of communication between each other. Okay, just if you are sitting inside a room and your room is closed, so it will be a closed chamber, right? The room is a closed chamber now, and there is no connection, or there is no sort of what opening through which you can communicate to the person in the other room, right? If the room is closed, your door is closed, so it is a closed chamber, and there will be a room next to your room, but you'll not be able to communicate through any means uh, since all the areas are closed. Such types of junctions, cell junctions, are called closed or tight junctions. There is no communication between the adjacent cells. Whereas in the case of gap junctions, there is some sort of communication, or there will be some sort of communication. They will be able to communicate with each other through small openings. And coming back to the same example, that is, if your door is open, okay, if the closed door has been opened, then you can communicate with the other person sitting in the next room through that open area, right? When the door is open. Such sort of junctions are called gap junctions. So there is a continuity, and we can communicate. The two cells can communicate through that openings. Such type of gap junctions are seen between the neurons, that is presynaptic and postsynaptic neurons, in the case of electrical synapse. That's what I meant to tell you. So in electrical synapse, there is definitely a continuity, or the two neurons are connected through gap junctions. And what happens is the information coming from the presynaptic neuron will directly go into the postsynaptic neuron. There is no need of the release of any sort of neurotransmitters or something. Okay, they can communicate directly because they have got a continuity, or they have got some sort of connection. So information can easily spread from one neuron to the other. That is electrical synapse. And it is mainly seen in cardiac muscle fibers, then smooth muscle fibers of intestine, and epithelial cells of lens of eye. These are the areas where mainly we can see the electrical synapse. Is it clear? Okay. Now, in this one you can see, this is the electrical synapse.
Disc.
Yes, electrical, intercalated disc. We can say like that also. So here, the presynaptic neuron communicates with the postsynaptic neuron through these cell junctions. These are the cell junctions, so they can communicate easily. The information or the impulse that is coming through this neuron can easily pass through this gap junctions to the next. And there won't be much delay in the transmission of impulses in the case of electrical synapse. That's the difference. That is the second difference between the electrical and chemical synapse. Means the time taken for the impulse transmission will be lesser in electrical synapse compared to the chemical synapse. Okay, and in chemical synapse, here you can see there is no connection, and so the neurotransmitters are released first into the space that is called the synaptic cleft, and they will contact, or they will bind on their receptors that are seen on the postsynaptic membrane. So there is, or there will be, some delay in transmission of impulses when it comes to the chemical synapse. Okay, and what may be the reason for that one? A slight delay.
No, because of the neurotransmitter vesicles are migrating, they have to release into the gap, the space
Cleft.
between the two the cleft. Yeah, and then they have to transfer in through the ion channel into the receiving cell. That takes more time than just
exactly. That's the correct answer for that one. Anyway, I'm happy that you are responding very promptly. Okay. Okay, fine. So that's the thing with chemical and electrical synapse, and that is the reason why chemical synapse faces a small delay compared to the electrical synapse. Okay. Now we'll move on into Now we'll move on to the structure of synapse. So in structure, there is not, we don't have to go much, I mean, it's not a complicated structure of synapse. As I said before, there's a presynaptic neuron and a postsynaptic neuron. The presynaptic neuron axon part will be communicating. Okay, the axon part will be communicating, and the postsynaptic neuron, mostly the dendrites, will be accepting the impulses or information. And sometimes the cell body or the axon part of the postsynaptic neuron. Anyway, there is no physical continuity, or they don't have any connection between each other. So the three main parts of a synapse are the axon terminal of presynaptic neuron, the synaptic cleft, and the dendrite of the postsynaptic neuron. These are the three main parts of a synapse: the axon terminal of presynaptic neuron, synaptic cleft, and the dendrite of the postsynaptic neuron. So these are the three parts. Then the axon terminals, they are also called synaptic knobs or synaptic end bulbs. Okay, axon terminal. One axon will be having so many axonites. It's at the end. Okay, there will be lots of branches, and those branches are called axonites. And all those axonites end in certain bulb-like structures called synaptic end bulbs or synaptic knobs. And it is, they are also called terminal knobs, terminal buttons, etc. And inside these synaptic knobs, we can see numerous small sac-like structures or small bubbles inside the axon terminals. And those bubbles or sac-like structures are called synaptic vesicles. And it is inside these synaptic vesicles we can see the neurotransmitter. Okay, the neurotransmitters will be entrapped inside this synaptic vesicles. That's how it happens. Is it clear? Okay. Then next comes the synaptic cleft, that is the space in between these two neurons, and the chemicals or the neurotransmitters will be released into this synaptic cleft. And usually in the synaptic cleft, we can see the enzymes related to the type of neurotransmitter released. Mostly the enzyme present there will be acetylcholine esterase. It's an enzyme that breaks acetylcholine to acetic acid and choline. So that enzyme might be will be present in most of the synapses. And then comes the postsynaptic membrane, usually the dendrite. And this dendrite will be having many receptors. And these receptors are purely meant for the attachment of the neurotransmitters on the postsynaptic membrane. That's the function. So the released neurotransmitters, whatever be the neurotransmitter, they'll be having specific receptors. If it is acetylcholine will be having nicotinic receptors. Then if it is adrenaline, it will be having their corresponding receptors likewise. So depending on the type of neurotransmitters released by each presynaptic neuron, the corresponding type of receptor will be present on the postsynaptic membrane. And that's the thing seen in the dendrite. And this postsynaptic membrane or the receptors will accept the neurotransmitter, and correspondingly the electrical events will start to happen inside the postsynaptic membrane. So this is about the part or the structure of synapse. Is it clear?
Yeah.
Okay. Any doubt till now?
What happens to the neurotransmitter after it is taken in? It gets broken down and reabsorbed, right?
Yes, it will be absorbed. That is called recycling and reuptake of neurotransmitter. We'll be studying about that. Yeah.
If there is still neurotransmitter in the cleft, it will get retaken.
Yes. It will depend upon the intensity of information or intensity of the stimulation that has arise or that has come to the presynaptic terminal. It will depend upon that one. Anyway, I'll come to that when we talk about the synaptic transmission. Okay. So this is the structure in detail. So these are the vesicles or synaptic vesicles inside which we can see the neurotransmitter. This is the synaptic cleft and postsynaptic membrane. Okay.
Yes.
Okay. Then moving on to the synaptic transmission. Now, I hope you have an idea of how synaptic transmission is taking place. So before moving to the transmission part, what do you know about resting membrane potential, action potential, and graded potential?
The resting membrane potential is the potential of the depolarized nerve cell, the neuron, which is in the default state.
Okay.
Its potential is when it's unexcited.
Okay.
It is depolarized. It is a negative potential.
Okay. Then action potential.
Action potential is its depolarization.
Okay.
Like when it reaches when it is excited, once it reaches a particular threshold, then it is action potential is taking place.
Okay. And what is graded potential?
Graded potential instead of a fast depolarization,
okay.
It is slower.
Okay. So among these three, which type of electrical potential is capable of generating a response?
Wait a minute. The one thing is that graded potentials actually don't follow All-Around law.
Okay. And are they propagatory? Graded potentials? Can they propagate? Are they propagatory or not?
Yeah, they are propagatory, right?
No, it is only the action potential. Yeah,
only action potentials can propagate.
Yeah, action potentials can propagate. Graded potential means there will be a small electrical potential difference, or there will be a small voltage difference in the membrane. So that means it gives an information, or it gives an idea that okay, some stimulus or some stimulation has happened in a membrane. That's the implication, or that's the information it gives. And when several graded potentials arise, it will give rise to an action potential. I'll just give you an idea. First of all, resting membrane potential means it is the electrical potential difference that occurs across a membrane when it is under rest. Okay, when it is in rest. So at that time, there won't be any sort of electrical activities taking place in that membrane. Like when we go to sleep, we'll be completely in rest, right? We won't be, okay, anyway, we'll be moving sometimes when we see some dreams or something like that, but still sleep means it's a complete rest to our body. Likewise, So here, the synapse, this one, resting membrane potential means the membrane is completely under rest and there is no sort of electrical activities taking place on that membrane. Now, when a stimulus acts on that membrane, there will be a small change in the voltage that happens. That is, the voltage fluctuation starts to arise when a stimulus is applied on that resting membrane. So how this electrical activity happens is, usually when we say the membrane is at rest, the outer side of the membrane will be positive and inner side will be negative, right? You know that, right? Okay. So this situation completely changes when a stimulus is applied on that area, on any area it means on the resting membrane. If we apply a stimulation in that area, it's just on the spot of stimulus application, the channels, especially the sodium and potassium channels, they will open. And what happens? The positive charge, especially in the stimulated area, the sodium ions will enter inside, making that part of the membrane positive, inner side positive, and the outer side will become negative. That is called depolarization. And if this depolarization is strong enough, okay, if it is strong enough, it will have the ability to spread to the adjacent areas. And if that stimulation or if that depolarization spreads to the adjacent areas and generates or it leads to the development of an action or a response, such voltage differences are called action potentials. Okay. And next one, the graded potential. Graded potential means it is intermediate to resting membrane potential and action potential. In resting membrane potential, there is no electrical activity at all. But in graded potential, when a stimulus is applied, there will be some voltage fluctuations or there will be some voltage deflections in that particular area. And if the stimulus intensity increases gradually, the stimulation or that voltage fluctuation will increase in its strength and finally will get converted into an action potential. Is it clear or did you get confused? It's clear.
Just say again, you mentioned graded.
Okay, I'll just give an example. Okay. Suppose you are sitting in a class where the lecturer who is giving you a lecture is very strict, and in his or her class, I mean, we'll say about his class, okay? In his class, no one in the class tries to move at least their head sideways, okay? Because that lecturer is very strict. So when you're attending such a class and somebody pokes you from behind, okay, what will be your response? You'll be sitting very dully, or what to say, you'll be sitting very low. And when the person from behind pokes you first, what will be your first response? Will you just turn around and ask him? Just imagine the person in front of you, the lecturer in front of you is very strict. So you won't
you want to suppress it.
Yes. And so what will you do? You will show some sort of response. That is, you will change your sitting posture, right? If the person poke, what will you do? You'll sit upright or you'll sit straight. Then again, when the person is poking you from behind, again, there will be some change in your body posture. Third time, when the person again pokes you from behind, when that time you'll find a time which will be apt, which will be okay for you to communicate in some way with the person behind you to know what's the thing for which that person is poking you. So when the lecturer moves from your eyesight or when the lecturer takes his eyesight from you, you'll just turn your head sideways and ask what is the matter. And again, if the person behind you is poking you once again, you'll think, okay, whatever be the consequence or whatever happens, I'll just turn around and ask what the thing is. So you'll just turn around and ask him directly what the thing Yes. So it is like a series of changes, or it is like a series of stages taking place, right? I said about 4 stages. First one is your first and second is your change in body postures. Third one is your sideways movement of your head to ask what the thing is. And the last one is the major response. That is, you turn around completely and ask the person what the matter is, or what the reason you're poking me from behind. Okay, so this is a series of actions taking place. Like this type of electrical activities that finally generates or finally leads to an action is called graded potential. Is it clear?
Yes.
Yeah, so initially there will be mild voltage differences on the membrane, and finally when the intensity reaches its maximum, or what you said previously, the intensity reaches its threshold or the firing level, the action potential will be generated. So that's the difference between a graded potential and an action potential. So graded potential means it is a small change, or there happens depolarization as well as repolarization happens, but it is not necessary that the graded potential will propagate from the site of stimulation to the next areas. It will propagate only if it turns into an action potential. Is it clear?